Welcome to the Cambridge Healthy Smiles program, operated under the Cambridge Public Health Department. Our mission is to improve oral health and increase access to dental care for pregnant women in our Cambridge community. Hi, Sharon. Welcome back to the dental office. It's so nice to meet your little one. How's everything going?
Hi, Melina. We're doing well, thanks. I want to make sure I'm taking the best care of my little one's oral health from the start.
You're doing a fantastic job by coming in today. Starting early is key. Let's talk about how you can keep your little one's gums and teeth healthy as she grows.
That sounds great. What about after her first tooth appears?
When that first tooth appears, switch to a finger brush with water. Here's what you do. Wash your hands. Position your child on your lap with her head resting against your chest for comfort and visibility. Securely place the soft silicone finger brush on your index finger. Gently open your baby's mouth by slowly pulling down her lower lip. Use the finger brush with soft, circular motions on the tooth and along the gum line. Brush your baby's teeth twice a day, ideally once in the morning and once before bedtime.
That's useful. What should I do for her dental care as she turns 1?
Around 1 year of age, you should switch to a soft baby brush with a rice-sized smear of fluoride toothpaste. Here's how. Wash your hands. Position her on your lap with her head resting against your chest. Apply a rice-sized amount of fluoride toothpaste on the toothbrush. Gently encourage your baby to open her mouth with a light touch on her chin. Use small, circular motions to clean the teeth and along the gum line, focusing on all surfaces of the teeth. If you're finding it challenging to brush your baby's teeth due to them being squirmy, sit on the floor or bed where you can easily stretch your legs out in front of you. Lay your baby down so that they are facing up, with their head positioned near or slightly between your knees. Gently bring your legs closer together, allowing your baby's arms to be lightly pinned against your thighs or knees.
That's helpful. Is there anything else I need to know?
Yes. Remember to rinse thoroughly with water after brushing. Use a flosser between teeth that touch. Replace your child's toothbrush every 3 months or after they have been sick. Schedule your child's first dental visit at around 1 year of age for an exam.
Okay, that makes sense. I'll plan on bringing her in for her first checkup soon.
That's great to hear. Consistent care at home and routine visits to the dentist are essential in preventing tooth decay and other issues.
Is it okay to give my baby a bottle of juice?
It's best to avoid filling your baby's bottle or sippy cup with juice or sweet drinks. Cambridge fluoridated tap water or milk is preferable to reduce the risk of cavities. Additionally, be cautious with hygiene products. Don't share cups or utensils with your baby, as it can transfer cavity-causing bacteria. Also, be mindful of things to avoid. For instance, avoid night bottle feeding and prolonged nursing at night, as these habits can contribute to decay by exposing teeth to sugars for extended periods.
Thanks, Melina. I feel much more confident about caring for her teeth now.
You're doing a wonderful job, Sharon. If you have any more questions or concerns, feel free to contact us at the dental office anytime. For more information or to become part of our growing community of the Cambridge Healthy Smiles, we invite you to visit our website where you'll find valuable learning materials and referral information. We're here to support you, so feel free to reach out to us directly at healthysmiles@cambridgepublichealth.org. Together, let's create lasting change, one smile at a time.